Good day, this is Jhunlie Escala and now I welcome you all back once again dito sa ating channel. And today, we will be discussing another important topic under the subject Fundamentals of Nursing, specifically on the concepts of vital signs. And first, we're going to discuss about the concepts of body temperature and your pulse. Are we ready? Ayan. So, I'm so sorry we weren't able to upload our videos for a week. I think it's because of the typhoon that we have experienced. I hope and I pray that every one of us is safe. I hope lahat tayo ay ligtas sa anumang sakuna. So we will be continuing and we will be learning today about your concepts of body temperature and pulse. So don't go away after this break. First, let's discuss about the concept of body temperature. You know what, class? Talking about your body temperature, let's have first a review of your hypothalamus and then your medulla oblongata. When we say class, hypothalamus class, it is the part of your brain which regulates the balance between your body heat or your body temperature. Upon the other hand, when we say medulla oblongata of your brain, this is considered as the vital sign center naman, class. Remember, what regulates balance between body heat? Okay, that is hypothalamus. When we say naman, class, what is the vital sign center, class? That is your medulla oblongata. Remember those things, class. Now, what are the types of your body temperature? Talking about the types of body temps, class, meron lang dalawa. First, class, is yung tinatawag natin core, okay? Or this is the internal body environment, okay? When we say core, again, that is your internal body environment. Upon the other hand, class, when we say naman surface, that is the external body environment. Again, kapag sinabi natin core, internal. Kapag sinabi naman natin surface, from the word itself, surface, external body environment. If you are going to notice, class, I highlighted some letters, class, into red, no? In-highlight ko sila, class. Kasi, class, para mas madali nating maalala, you have to remember that core, loob. Okay? Kapag sinabi naman natin surface, class, surface, labas, surface. Okay? Again, kapag sinabi natin core, that is the internal body environment sa loob. Okay? Kapag sinabi naman natin surface, class, external body environment sa labas. Yan. Okay, let's continue. Now, class, what is your normal body temperature? Okay, for adult, class, remember, 36.5 to 37.5 degrees Celsius. Upon the other hand naman, class, kapag for infant naman, that is 36 to 36.7 degrees Celsius. Okay? For adult, 36.5 to 37.5 degrees Celsius. Upon the other hand, for infant, that is 36 to 36.7 degrees Celsius. This is according to Kosher or Berman and Snyder book ninyo. Let's continue. Now, what are the types of fever? Eto, I have to highlight this one because suking-suki ito sa board exam. Okay, tandaan ninyo, what are the types of your fever? Okay, types of fever, number 1, we have your intermittent. Okay, tandaan ninyo, we have your intermittent or sabi sa Pinoy, intermittent. Okay, intermittent, class, ganito. Okay, it has fluctuations. Remember that one. It happens in 24 hours. Okay, it goes back to normal. Again, it has fluctuations. It happens within 24 hours and then it goes back to normal. Ibig sabihin, class, meron siyang fluctuations, class, na nangyayari in 24 hours or sa loob ng isang araw. At you have to remember that kahit may fluctuations, class, okay, nagiging normal pa rin ang temperature natin dito. Example, class, isang araw, September 7 of this year, example ha, hypothetical. At 7 a.m. class, nasa 38.9 degrees Celsius ang temperature ng pasyente. Okay? Mataas, mababa, mataas. Okay? Abnormal, normal, class, abnormal yan. Okay? At 11 a.m. naman, class, bumaba siya, class, ng 36.2. Class, normal, mataas, mababa. Of course, that is normal, class. Within the normal range na, class. Ganito. Okay? Now, ganito yan. Naging normal, class. Okay? Tapos, At 7 p.m. class, nagkaroon ng 39.6 degrees Celsius class, okay, na temperature ang pasyente ninyo. Class, mataas ba yan? Yes. Febrile ba yan? Yes. Okay, now, considering this example class, may fluctuations ba? Yes. Abrupt ba? Yes. Very good. Pumasok ba sa 24 hours? Yes. Nagno-normal ba? Yes. At 11 a.m. class, nasa normal class. That is your intermittent body, okay? Temperature or intermittent type of fever. Tandaan niyo, it has fluctuations. It happens in 24 hours, okay? And it goes back to normal. Tandaan niyo yan, class, okay? Now, another class is yung tinatawag nating remittent, okay? Tandaan niyo, remittent. Ito naman, class, it also have fluctuations, okay? May fluctuations rin siya. It also happens in 24 hours. Okay, pareho lang rin kay intermittent di ba? Now, it has fluctuations, it happens in 24 hours. But remember, but it does not go back to normal. Okay, hindi siya bumabalik sa normal. Okay, now, example, September 7 na rin the same day. On the same day, class, at 7 a.m., 38.1 ang body temperature ng pasyente mo. Abnormal? Yes. Mataas? Yes. Febrile? Yes. Okay. At 11 a.m. naman, class, biglang tumaas. Abruptly, class, nagkaroon ng fluctuations at 40.9. Mataas? Yes. Febrile? Yes. Okay. May fever ba? Yes, of course. Now, at 7 p.m. naman, class, medyo bumaba siya abruptly also at 38.1. Pero mataas pa rin ba? Yes. Febrile pa rin ba? Yes. Very good. Now, at 10 p.m. naman, class, nasa 40.6 degrees Celsius. Mataas pa rin ba? Yes. Okay. Nangyari ba ang lahat within 24 hours? Yes. Bumalik ba sa normal? Hindi. May fluctuations ba? Yes. That is what we call as your remittent fever. Tandaan ninyo, class, remittent fever. Okay, ang pagkakaiba ni intermittent and remittent, class, yes, they have the same sila, class, may fluctuations. Both class happens in 24 hours, but intermittent does not go back, intermittent class goes back to normal. Upon the other hand, remittent naman, class, does not go back to normal. Tandaan natin yan, class, ha? Remember these two. Now, class, we also have another type of fever, class, is yung tinatawag nating relapsing. Sa relapsing naman, class, yes, may fluctuations rin siya, but it does not occur, class, in 24 hours. It occurs in several days or even umaabot siya ng linggo, okay? Or even weeks. Tandaan niyo yung class, have fluctuations but occurs in several days or weeks. Next class is yung tinatawag nating constant. When we say constant naman, class, that is 41 to 42 degrees Celsius, class, constantly mataas from the word itself. Hindi siya bumababa. Okay? Parati siyang may fever at 41 to 42 degrees Celsius pataas. Now, class, this is common. You have to remember that this is common, class, among viral diseases. Tandaan nyo yan, class. Okay, what are the 4 types of fever, class? Remember, class, it goes back to normal. Okay? May fluctuations in 24 hours. Okay? Anong tawag doon? Very good. That is what we call as intermittent, class. Hindi bumabalik sa normal within 24 hours, class. Ang tawag natin doon, class, is remittent. How about, class, that have fluctuations within several days or weeks? Ang tawag natin doon ay relapsing. Ano naman, class, yung 41 to 42 degrees Celsius, class, constantly mataas? Ang tawag natin dyan, class, is constant fever. Okay, let's continue. Now, class, ano naman, class, ang types of decline of fever natin? When we say, class, types of decline of fever, class, meron tayong una. What we call as your crisis. Okay. Halimbawa, class, ganito. Mayroon palang nangyayaring decline of fever. Okay. Halimbawa, class, mataas yung body temperature mo at 40 degrees Celsius. Tapos, bababa siya. Okay. We have 2 types of decline of fever na tinatawag natin, class. First is yung tinatawag natin crisis. When we say crisis, class, this is the abnormal type. Why? Because this is sudden or abrupt. Ibig sabihin, class, mabilisan. Okay? It is usually caused by damage to hypothalamus. Example, I experienced, okay, a vehicular accident. Okay? Hypothetically. Now, upon assessment by the rescuer, class, mataas ang body temperature ko at 40 degrees Celsius. Now, class, the question is it because of the rapid invasion or rapid microbial invasion? Nagkaroon ako ng rapid infection? Now, class, no. The answer is no. Okay? Most probably, this is because to the damage to the hypothalamus. Remember, class, on our very first concept natin, your hypothalamus, class, regulates, class, your body temperature, class. Halimbawa, class, nagkaroon ako ng head injury or brain injury, class, which affected my hypothalamus, class. Now, kapag abrupt daw, class, ang pagbaba, class, ng ating fever, that is what we call as your crisis. And it is usually caused by damage to hypothalamus. Okay, pangalawa. Pangalawa, class, is yung tinatawag nating lysis. When we say lysis naman, class, dito, the decline of fever is something that is normal, or this is the normal type of decline of fever. Okay? In here naman, class, there is a gradual decrease of body temperature. Upon the other hand, class, kung sa crisis sudden, dito naman, class, a gradual decrease of body temperature. Okay? This is lysis. Remember, crisis, from the word itself, class, something that is negative, it is something that is abnormal. Okay? Sudden and abrupt. Okay? Usually caused by damage to hypothalamus. Pangalawa naman, class, decline of fever is yung tinatawag nating lysis. Ito naman, class, yung normal type. Okay? Bakit? There is a gradual decrease of body temperature in here. Remember that thing, class. Okay? Now, let's continue. Let's continue to your methods of heat loss. Ito, suking-suki rin sa boards. Madalas tanongin at napaka-basic at importante, class, that we should be remembering and we should be understanding these concepts here. Okay, first, methods of heat loss. Paano nga ba nagkakaroon ng heat loss? First is yung tinatawag nating conduction. Okay, this is the transfer of heat by contact. Okay, the transfer of heat by contact. Example, class, hinawakan mo yung pasyente, class, ha? Okay, nanlalamig yung pasyente. And then, you medyo mainit yung kamay mo, okay? The heat na meron ka, no, in your body, no, it will be transferred to your patient. Okay? Best example yan, halimbawa mainit-init pa yung kaldero nyo kasi no, baging saing. Tapos, ikaw naman, kasi gutom na gutom ka na, you immediately went to the kitchen. No? Pagdating mo sa kitchen, class, ay nako, hinawakan at binuksan mo agad yung kaldero. Ayun, napaso ka. Okay? Now, the heat that's coming from the kaldero, okay, nahawakan mo yon, and then nagkaroon ka ng reaction. Nabitiwan mo kaagad yung takip ng kaldero ninyo. Okay, that is what we call as conduction. Because there is a the transfer of heat, no, by contact. Okay, direct contact yan. Pangalawa, class, is yung tinatawag natin convection. When we say convection naman, class, this is the transfer of heat by air current. Okay, by air current. Example, class, sa mga exhaust fan, di ba, in your aircon, di ba? Halimbawa, yung mga rich kid na mayroong mga centralized aircon sa kanilang bahay, class. Ganito ang nangyayari. Sa exhaust ninyo sa aircon na yan, sa labas, class, mainit, class, ang lalabas na hangin dyan. It's because yung init sa loob ng room, class, nilalabas ni exhaust fan. Now, class, kapag naiinitan ka, class, doon sa exhaust fan na yan, class, it is by virtue of your convection, which is a method of heat loss by air current. Remember that thing, class. Okay. Pangalawa, class, ito. This is very, very common. Okay, the transfer of heat by mode, no, without any contact. Okay? Example nito, this is very, very common. Every day we have this one, ang sunlight. Okay, na ayaw ng mga kapatid at mga classmates mo na nagluluklok, class, ng glutathione. Okay? Now, class, ang tawag dyan ay radiation. Okay, pang-apat, and the last one, class, is yung tinatawag nating evaporation. Okay, when we say evaporation, class, this is the transfer of heat by water vapor at alam na alam mo. Yan. Now, class, one time tinanong sa boards is what is the type of heat loss or what is the method of heat loss in your TSB or your tepid sponge bath. Okay, or your tepid sponge bath. When we say, class, TSB, class, the method of heat loss there, class, is your first is through conduction. Why? Because directly, class, nagkakaroon ng contact, okay, yung sponge na ginamit mo and then the patient's surface, the body surface of your patient. Okay, first is by conduction, but later on, class, the heat, no, in the patient's body or the surface of the patient's body, class, okay, will later on evaporate. So, firstly, that is through conduction, and then later on, through evaporation. Tandaan nyo yan, class, ha? Okay, that's very, very important at tinanong na yan sa boards once. Remember those things. Next, what are the routes in taking your body temp? Ito, alam na natin. But we have to remember some specific principles here, class. Okay. Now, unang-unang route is yung tinatawag nating oral. When we say oral class, this is the most convenient and most accessible route. Remember this thing, class. This is the most convenient and most accessible route. Class, you have to remember this number. 15 to 30 minutes. Why? You have to wait 15 to 30 minutes after cold or hot beverages ng patient. That's why it is very essential and very important for you to ask kung si patient ba uminom ng mainit or malamig na inumin. Why? Because it could alter the result, okay? Or it could come up to a result na hindi naman tama, okay? It's either false high or false low. Okay? Now, you have to wait for 15 to 30 minutes. Very good example na tinatanong yan sa boards. Halimbawa, ang pasyente class dumating. Okay? And then verbalize na tapos pa lang ako magkape in 2 minutes siguro. Okay, nagkakape. Tapos pa lang ako magkape. Now, you have to wait for 15 to 30 minutes before you take the body temperature of your patient. Tandaan yun, class, ha? Okay. Now, I was also shocked of this very, very concept. Kapag tinatanong tayo, class, ang site, where do we put, class, the thermometer, class, sa patient's oral cavity, class? Ay nako, kasi kadalasan we put it above the tongue. It should actually be, according to Kusher, Urberman, Snyder, sublingual route. Tandaan nyo yan, class. It should be sublingual route, class. Okay? Now, in cleaning naman, class, your thermometer using your oral route, class, before using, you have to clean it from your bulb to the stem. Okay? Now, after using naman, you have to use, class, the stem to bulb method. Why? You have to remember, class, asterisk yan kasi once lumabas yan sa boards, you have to remember the concept of cleanest to dirtiest. Okay? That is your oral route. Now, class, there are some contraindications, class, na kung saan hindi natin pwedeng gamitin ang oral route in taking body temperature. Okay? What are the contraindications? You have to remember you scanned. Okay? You have to remember SCAND. Okay? What are these? Number 1, seizure. Bawal yan, class, sa mga nagsi-seizure, class. Okay? Alam na natin yan. Okay? Pangalawa, cough. Okay? Yung ubo ng ubo. Bawal yan, class. Okay? And then you also have to consider the age of the patient. Okay? Highlight lang, class. For the patients na below 5 years old, bawal yan. Why? Because ang priority natin dito, class, is septe. Okay? You have to prevent your aspiration. Priority, septe. Okay? Now, class, nausea and vomiting. Also, bawal yan sa mga pasyente, class, na nagsusuka, class. Okay? Nahihilo, class. Bawal yan sa kanila. Again, priority, safety. Okay? To prevent aspiration, class. Okay? Another, class. Bawal rin yan, class, sa mga pasyente na may decreased level of consciousness, class. Okay? Bawal yan sa mga pasyente, class, na may decreased level of consciousness. And you have to remember that priority, class, is always safety. Why? Because it may, class, obstruct, no? The thermometer may obstruct the airway of your patient, class, kapag ginawa mo mga bagay-bagay na to, class. Seizure, okay? Cough, yung mga below 5 years old na patients, nausea and vomiting na patients, class, decreased level of consciousness na patients, class, tapos pinagpatuloy mo pang pagkuha ng body temp using your oral route, class. That's very, very dangerous. Remember these contraindications. Okay? Next, class, is yung tinatawag nating another route, class, is your rectal rod. Okay. Now, remember, your rectal rod, class, is the most accurate and most reliable route. Okay? Remember this thing. Okay? Again, this is the most accurate and most reliable route. Okay. How do we position the patient? We position the patient left side lying, or otherwise known as your Sims lateral position. And actually, the best position here is your Sims lateral position. Remember that thing, class. Okay. We also have to use lubricant, and we should be using water-based lubricant. Avoid your oil-based lubricant, class. Okay. And length, class, of your insertion is from 0.5 and up to 1.5 inches. Again, from 0.5 to 1.5 inches. Ganyan lang, class, kahaba. Wag sobra, class. Okay? 0.5 to 1.5 inches. Now, we also have contraindications in using your rectal route. Ibig sabihin, class, bawal natin gamitin ang rectal route, class, upon these certain conditions. Okay? You have to remember contraindications for rectal, class, RC. What is this RC, class? On first, class, we have your rectal problems. Okay? First class, you have your rectal problems. Okay, what are these rectal problems? Example, diarrhea. We also have the imperforated anus. Okay, and we also have the hemorrhoids. Okay, we also have the hemorrhoids. Now class, alam nyo, when I was still a student and when I immediately became a clinical instructor somewhere in Leyte, I once asked my students, bakit ginagamit natin ang rectal route upon checking the body temperature? Kasi this is very, very standard, no, na ginagamit natin ang rectal route for checking the body temperature of the newborn. Yes, of course, the reason is, yes, because we are about to get the most accurate and most reliable route, no? The most reliable source of your body temperature, which is the rectal route. Now, aside from that class, we also are checking actually a certain condition ng patient na kung saan merong class problem in the anal orifice of the baby. In short, there is a blockage in the anal orifice or rectal orifice of the baby. Okay? Now, when I ask my students, they immediately answer class imperforated anus. Imperforated anus. Yes, imperforated anus class is correct. Okay? In so far as the condition of the rectal area or rectal orifice is concerned. However, there is a specific condition class from among the newborns wherein their anal orifice is either blocked or underdeveloped. Okay? Blocked or underdeveloped. And the reason class is always something that is congenital or happened while the baby was developing class inside the womb. Now class, ang tawag natin doon sa condition na yun class, you have to take note this one, is ang tinatawag nating anal atresia. Okay? Remember class, the anal atresia. Okay? Anal atresia. Also class, bawal rin yan sa may mga hemorrhoids. Okay, first R is your rectal problems. Pangalawa class is your cardiac problems. Bawal yan class, okay, sa may mga cardiac problems, lalong-lalo na class yung mga pasyente class na bumababa yung kanilang heart rate. Why? You have to remember class that the vagus nerve, which is the longest elongating cranial nerve, no, from the base of your brain up to the, okay, anus natin. Okay? There is the vagus nerve. Now, one of the function of your vagus nerve class or one of the reactions class if triggered or stimulated is to remember vagus vagal. Okay? Vagal vagal. Okay? Pampavagal ng puso class. Kapag na-stimulate natin ang vagus nerve na yan class, okay? Mabababa pa class ang ating heart rate class. Now, you have to remember that this must be contraindicated for those patients class na mababa na ang pulse rate or heart rate niyan class. Halimbawa, what is your normal heart rate class? 60 to 100. Kapag bumababa pa ng 60 class, wag na natin gamitin class yung rectal route ng body temperature taking. Remember that thing class, okay? Remember that thing. Okay. Next. Next class is ang tinatawag nating axillary route. Okay. Now, when we say axillary naman class, this is the safest and the most non-invasive route. Okay. Now, before doing your axillary route and taking body temperature, you have to remember and you have to do this thing. You pat dry the axilla. Okay. You pat dry the axilla. It should be pat class ha. Remember, not rubbing. Why? Because when you rub your axilla or your armpit class, it may cause increase, no? It may lead to the increase of temperature in that certain part, no, of your body. Okay? That's why pat dry lang siya, class. Okay. There are things actually that you must consider kasi class, they are contraindicated for those patients, class, na meron itong condition. Axillary route of taking your body temperature, class, is contraindicated for those patients na may AC, class. Okay? Axillary lesion, class, and then CVA. Or your cardiovascular accident. Why class? Ang mga CVA patient natin class, they are, okay, most probably class, nagkaroon sila ng paralysis of some parts of their body, which enables them class to elevate their axilla or extremities class. That's why class, it must be contraindicated for those patients class na mayroong CVA. Tandaan nyo yan class ha. Okay, very good. Another class, Okay, last but not the least, of course, is your tympanic. Okay, tympanic, isang bagay lang ang kailangang tandaan natin, that this is the fastest. Remember, class, okay, this is the fastest route in taking the body temperature. Now naman, class, let's take about your pulse. Okay, pangalawang konsepto natin dito sa discussion na to. Okay, let's talk about your pulse. Now, class, when we say pulse, this is the pumping ability of the heart. Okay, this is the pumping ability of the heart. Again, the pumping ability of your heart. Now, class, let's talk about what is the normal pulse. When we say normal pulse, class, for adult, class, that is 60 to 100 beats per minute, at alam na natin yan. Again, 60 to 100 beats per minute. Upon the other hand, for infants naman, class, that is 120 to 160 beats per minute. Mas mabilis, class. Mas mabilis para sa mga infants natin. Okay? Now, okay. Next, class, is yung tinatawag nating pulse deficit. When we say pulse deficit, class, this is the difference between the apical pulse and your distal pulse. Okay, class, question, what is that apical pulse? The apical pulse, class, ito yung pulso natin in your fifth intercostal space, mid-clavicular line, class, sa left side, class, ng ating chest. Okay, in short, ito, class, yung site na kung saan nakikita natin na ino-auscultate, class, ng mga doctor sa mga paborito mong pelikula ni Nora Honor, ni Vilma Santos, ganyan, kapag mga drama na nasa hospital na, tapos may auscultate, class, dito sa bandang dibdib, class, this is your apical pulse. Okay? Now, when we say apical pulse, again, that is the difference, class, between your apical pulse, when we say pulse deficit, rather, that is the difference between your apical pulse and distal pulse. So, AP minus DP, class, that is your pulse deficit. And, okay, according to the book, class, what should be the normal pulse deficit and what is the standard or normal pulse deficit? It should always be 0. Why? Kapag merong, class, pulse deficit, there is something wrong. Okay? There is something wrong, and we will be discussing those things, class, in your medical surgical nursing discussions. Okay, remember the thing, your normal pulse deficit is always set at 0. Remember, another concept, class, is yung tinatawag nating pulse pressure. When we say pulse pressure naman, class, that is the difference between your systolic BP and your diastolic BP. Okay? The difference between your systolic BP and your diastolic BP. Now, class, dito, okay, ang formula na naman natin dito is your pulse pressure, class, SBP minus DBP, class. Halimbawa, class, ang BP ng pasyente ninyo is 120 over 80. Okay? 120 over 80. Your systolic BP there is 120. Okay? Minus diastolic BP, which is 80. So, the difference there, class, is 40. Okay? The pulse pressure is, of course, 40. Now, kapag tinatanong tayo, what is your normal pulse pressure, class, according to the book, that is 30 to 40 millimeters mercury. Tandaan niyo, class, okay, that is 30 to 40. So, in our example, of course, the pulse pressure is still normal. Next concept, class, is yung tinatawag nating pulse amplitude. When we say pulse amplitude naman, class, this is the strength of pulse. Okay? This is the strength of your pulsation or your pulse. Okay? Now, we have a scoring in measuring your pulse amplitude. Okay, what are the scores? Okay, for 0, class, it means absent. Okay, for thready pulse, no, we'll be giving 1. And for normal pulsation, class, or normal pulse, no, it should be 2. And for bounding or full pulsation, okay, the score is 3. Okay, remember that the highest is 3, the lowest is 0. 0 means absent, 2 means normal. At ang pinakamalakas, class, that is set at 3, no? For a score of 3 na bounding and full pulsation, class. That is how you score your pulse amplitude. Okay? Now, next. Let's discuss naman, class, about your sites. Saan natin makikita ang inyong mga pulses? Okay. Number 1, class, is your temporal pulse. Remember this thing. Okay? Saan natin makikita to? This is found in your lateral aspect of the eye. Okay? Sa lateral aspect of the eye. Okay? Pangalawa, class, is yung tinatawag nating carotid pulse. Okay? Carotid pulse. Saan naman natin ito makikita? In your lateral aspect of the neck below the earlobe. Okay? Below the earlobe. Now, class, that is your, what we call as your carotid pulse. And this is commonly used for CPR, no? For adult CPR. Remember that thing, class. sa adult CPR siya ginagamit. Okay, makikita natin na may mga rescuer class and they will be touching, okay, the lateral, or they will be finding, no, for your pulses, okay, your carotid pulse in the lateral aspect of the neck below the earlobe class. That is the carotid pulse. Okay, commonly used in CPR, adult CPR class. Remember the thing. Now, number 3. Number 3 class is yung tinatawag nating apical pulse. Ito yung sinasabi natin kanina. Found in your left sternal border, 5th intercostal space, mid-clavicular line. Okay? Most commonly auscultated. Ito yung sinasabi ko kanina. And this is otherwise known as your PMI, or your point of maximal impulse. Ibig sabihin, okay, dyan yung pinaka-precise. Okay? Kasi directly nasa heart siya. Okay? This is your apical pulse. Number 4. Next is yung tinatawag nating brachial pulse. Ito mahalaga rin. Okay? This is found medially along the antecubital fossa, and this is used for BP taking. Okay, ito yung malapit sa dito sa antecubital fossa ninyo, okay, sa likod ng siko, okay, and this is used for BP taking. Okay? And also used in infant CPR. Remember that thing, class, used for infant CPR. In infant class, we don't use the carotid pulse class. Okay? Rather, we use the brachial pulse of the baby. Okay? Remember that thing. Next is yung tinatawag nating radial pulse. Okay, saan natin mahahanap ang radial pulse? This is found along the wrist class, sa thumb side. Okay? And also used class for Allen's test. Okay? Remember that thing, class. Ginagamit natin siya sa Allen's test. Okay? Along the wrist, sa thumb side class. Okay, used for Allen's test. Next class is yung tinatawag nating ulnar. Okay, ulnar pulse class. This is also along the wrist class, pero sa last finger side siya, class. Okay, and also used for Allen's test. Kung kanina, sa inyong radial class, nasa thumb finger side siya, dito naman sa ulnar class, nasa last finger side siya. Okay, and used also for your Allen's test. Next class, okay, your femoral site class, your femoral pulse. This is found along the groin or inguinal area, class, and used for renal angiogram and your cardiac catheterization. Remember that thing, class, na ang femoral, class, ay nasa groin or inguinal area natin at ginagamit siya, class, for some invasive procedures such as your renal angiogram and your cardiac catheterization. Okay? Example, class, in your PTCA or your percutaneous transluminal cardiac angiography class, na kung saan, class, ginagamitan ng dye at dito yung pinapadaan, class, sa femoral artery ninyo, wherein, class, nandoon yung inyong femoral pulse, class. Remember that thing. Okay? Now, next class is yung tinatawag nating popliteal. When we say popliteal, at the back of the knee, sa likod ng ating mga tuhod, okay, doon natin makikita ang popliteal pulse natin. Okay? Remember that thing. And then, we also have your pedal pulses, class. And your pedal pulses, meron tayong dalawa. The dorsalis pedis and then your posterior tibia. Okay? And remember that both are used for checking circulation in the lower extremities. Ito, class, yung ginagamit natin, okay, in checking your circulation in the lower part of our body. Okay? Specifically in the lower extremities. Okay? Sa ating mga legs. Okay? And then, hanggang sa ating mga feet. Okay, remember that thing, class. We have your dorsalis pedis and then your posterior tibia. That's it for... Okay, that's it for today. Thank you for being with me. I hope that you have learned about the fundamentals of nursing, specifically in the concept of your body temperature and your pulse. Okay, subscribe to this channel, class. And we will be uploading more and more videos para mas maging matatag pa ang ating karunungan about the nursing concepts. Now, isang tanong, isang sagot. Lalaban ka ba? Gaganap ka ba? Okay? RN ka na ba? Gregorio ka ba? Have a nice day.